Hello everyone. Good evening all. Hope you all are doing well. Today is our first session for clinical batch 14. It's just a trial classes for role play session. Today we are going to discuss random cases, how actually the case are coming in your main exam. It's just a random cases from medicine, ONG, surgical cases, and peers. And also, there would be the case of psychiatric as well. So, who you are guys interested to perform, you can write your name in the chat box and we can start. Before beginning, I'll tell you just how to perform. So, the structure of this role play session, I'm going to perform today like 4 or 5 cases. And as I said, it would be random cases. So each case, you will get 10 minutes time. So 2 minutes reading time and then 8 minutes performance time. After finishing your performance, I'll give you feedback. Okay. I will also discuss the case, how you need to perform, what is the key point of each and every cases, okay? And if you do have any question, please feel free to ask in the chat box. I'll try to answer, okay? So let's start the session. Who wants to perform?
Hi, doctor. It's me, Dr. Rabia. Can I perform? But it will be my first time. I just started the course.
That's totally fine. I'll share my screen first. So, Dr. Rabia, this is your
Yes.
case, and
Okay.
you will get 2 minutes time for reading.
Okay.
And after finishing 2 minutes, then 8 minutes will be performance time. Okay?
Okay, sure.
So your 2 minutes starts now.
Okay, I've read the case.
Still, you have 1 minute left.
Okay.
So just read for 2 minutes, okay? And you need to think about the key point and what you need to mention. Um, your 8 minutes starts now.
Okay. Am I taking the history from the patient or from the nurse?
From the nurse.
Nurse. Okay. Hi, I'm Dr. Rabia, and today I'm the doctor over here. I'm going to take um, a small history about this patient, and we will further discuss the plan, because I heard that the patient is having complaint of loose motions, and this is the fourth post-operative day. So I just wanted to know how many, what's the name and age of the patient?
So patient named Mr. John, and patient he's a 45 years old man, and today is the day for post-op right hemicolectomy for cecal cancer.
Okay. Is the patient stable, vitally stable and responding?
So that's the chart.
37. And is the patient dehydrated?
Um, how you are going to check dehydration?
Dehydration from the skin, turgor, and tongue, because the patient is having loose stools. So just wanted to check if the patient is dehydrated or not.
So dry mucous membrane and capillary refill time more than 33 seconds.
Okay, sunken eyes. Okay. So when did the patient had his first loose stools? For how long duration the patient is having the loose stools, and how many times
Since morning
since
and multiple time.
since morning? And is the patient conscious, in like can pinpoint pain, where the patient has pain,
Patient just complain about generalized abdomen pain.
generalized abdominal pain? And is there any episodes of vomiting?
No vomit, but he's complaining about nausea.
Nauseous there. And loose stools, is there any mucus or blood in the stools?
No,
Okay. Is there any discharge from the surgical site? Is there any is the surgical site cleared? Is there any pus or any discharge from the um, uh, dressing?
no,
Because the post-op day.
it
Okay,
looks clean.
okay. Has the patient started to eat orally?
Just a clear fluid at the system moment.
Okay, and mm, okay, and there is
Anything you want to know?
yes. I want to know if the patient. What else I need to ask? Yes. Um, is is there any IV lines passed, like catheterized? Is the patient catheterized? NG tube and Foley's?
So patient iris is on and NG tube, no NG tube.
No NG tube. And what else to ask? Hmm. So this patient, at what stage of cancer was this patient diagnosed previously, for this for which the surgery was done?
I don't know, doctor. I'm just a nurse. I don't know about the extension or staging of the cancer.
Okay, and so there is no fever at the moment.
No, temperature,
It's
as I
30.
told you, is 37.8.
And what is the GCS of the patient?
Patient is alert oriented.
Alert and oriented. And so what else to ask about this? Because surgical cases. And is there any um, um Any family history of cancers in the family? And does this patient has any is he diabetic, hypertensive, or any other medical condition he has?
Um, I don't know, doctor.
Okay. And what medicines he's taking? Are there any medications he's taking, like metronidazole or any other medication?
Yes, doctor. That medication chart, he is currently on antibiotic.
On antibiotic. Which antibiotic he's taking?
He's taking ceftriaxone and metronidazole.
Ceftriaxone and metronidazole. And he's taking since today or since fourth. This is the fourth post-op day, so he's taking from the first day.
Yeah, so it's almost 4 days now.
Okay. And can you tell me the urine output?
We can check.
Input and output chart. Is there any input and output chart?
Uh, yes, doctor, but we haven't finalized yet. So I can check. So urine output last 6 hours is almost like 500.
500.
So doctor, what do you think about that OBS chart? What do you think
Yes.
about vital sign?
I think the heart rate is increased, temperature is normal over here, and the patient can be like hypertensive, but the increased blood pressure can be due to dehydration, and respiratory rate is increased as well. Also, like I wanted to ask about any previous medical illnesses the patient has, so the nurse don't know about that. And should I explain my differentials and investigation to the examiner?
Yes. So what do you think? What's your differential in this case?
So, Mr. Examiner, this patient presented a 45-year-old man on day 4 after hemicolectomy, right hemicolectomy for cecal adenocarcinoma. Now the patient is having loose motions since 1 day. Um, uh, this can be antibiotic induced diarrhea, metronidazole induced diarrhea, one of the differentials, because the patient is taking
Your time's
antibiotic.
up. Dr. Rabia, very nice performance. Like what I noticed, like I saw
I'm
your
sorry,
report.
this is
No,
my first time.
that's
I
totally
developed
fine.
guts to, yeah, talk. That's mm.
Yes, that's I can see that you performed for the first time, but I really appreciate your effort. Um, so couple of things I can correct you. So do you know like how to take a history?
Yes, I know, but I
That's
haven't
okay.
taken any course.
Oh,
So
that's totally fine.
surgical, yeah, surgical.
No, so each and every we have medicines surgery, so you can follow the same structure how to take a history, and like peers there are like a special structure for peers history taking ONG same and also psych also same like other different type of structure how you need to take a history. Okay. So in here, as I said, like it's a random role play session. So basically, my focus is the case which are coming frequently in each and every month. I'm just discussing those cases. Okay. So I will just make you familiarized about all the like new clinical cases that are coming each and every month. And Dr. Arshan, basically, he's taking all the theory classes. So he will
Okay.
teach you like how to take a history, like subject wise, like medicine, surgery,
Okay.
ONG, PEERS, psychiatry, like that. Okay. And he will also teach you like cluster wise approach. But my session for random role play is my main focus is just you will get uh, the clinical cases that are coming frequently. Okay. So in here, as I said, like that surgical case, you can follow the same history pattern. So basically, history of presenting complaint you have to ask. So in here, history of presenting complaint is loose motion. It doesn't matter, like either you have to take a history to the patient or to the nurse, but your structure would be the same. Okay, even though if you need to take a history from your examiner, again, the pattern would be the same. So history of presenting complaint, if and after that, like associated symptoms, you need to um, take a history about differential and also like generalized question like past medical history, social history, especially smoking, alcohol history, any IV drugs use, family history, past surgical history that is important, and any regular medication. Those are your history pattern. And like then coming to the physical examination. So physical examination again, general appearance, and then like you need to ask about vital sign, then focus systemic examination like head to toe. So start with chest, cardiovascular, abdomen, leg, like that, and explain your differential. Okay. I'm not going to explain how you need to take a history. As I said, like those are you will learn from your theory session. I'll just tell you. So in this case, I will discuss the case so that you can learn what point you missed. Basically, your history taking pattern was not correct. So you need to mainly focus on structure at this stage, okay? Because you are a beginner. And my suggestion to you, just if you are following that cluster-wise approach, you will learn very quickly, okay? So let's discuss the case. You are the surgical resident reviewing 45 years old man, day 4 post-right hemicolectomy for cecal adenocarcinoma. The nurse reports he is having loose motion today. So your task is take a focused history, explain to the examiner what you will see on the observation chart, explain your differential investigation and initial management with the reason. So now you need to think about day 4 post-op after like cancer removal. What could be the reason of the loose motion? Okay, there could be a couple of reasons. So history of presenting complaint. First, you need to check either patient is vitally stable or not. Okay, so based on the vital sign, it looks patient currently hemodynamically stable, just a bit tacky. That's it, and mild temperature elevated. But you don't need to do anything at this stage. So just focus on history. So history of presenting complaint is diarrhea. Ask about when did the loose motion start, frequency per day, volume, either it's a large amount or a small amount, watery, any form of stool, any blood, any mucus in it. Then associated symptoms like any fever, chills, any nausea, vomiting, any abdo pain, any urgency to go to toilet, like you need to ask, and also dehydration question. So basically, you should ask about dizziness. How about the urine output? Okay. What I noticed, like when Dr. Rabia asks me question, so that's couple of tips I want to share with you guys. So don't ask multiple question at a time. Okay. So highest you can ask two question at a time. Otherwise, like your role player might like not answer your question, and you thought that could be irrelevant or something like that. Okay, so always ask highest two questions. So whenever you are asking, like, can you tell me how many times per day, and is there any blood, any mucus? That's it. You don't need to ask like how many times per day, any bloods, any mucus, any fever. Don't ask like all the question at a time. Okay. And then post-op complication, like you should ask about any increased abdo pain. So when you ask about abdo pain, you should ask about surgical site pain, or is it the same pain, or do you think that pain getting worse? As I said, like any distension feeling, inability to pass gas, wound discharge or redness. Have you noticed? Are you passing vein? Then ask about diet. So how about your oral intake? Have you started taking oral like liquid or solid? Any new food? or any like diarrhea that have you noticed any greenish color diarrhea, you should ask. Then medication, so patient might take antibiotic, ask about it, and also pain medication, especially all the opioids. And after that, like patient might have like laxative. Laxative also can cause overflow diarrhea. So just ask about it. And any previous history of IBD, IBS, any prior surgeries, previous C. diff history, and the red flag in this case, any high grade fever, hemodynamic instability, and very like localized pain. So as I said, like based on the vital signs, so temperature mildly elevated, that may suggest infection or inflammation and be tachy as well. So the tachycardia also give you idea about dehydration, pain or infection. Blood pressure is stable at this moment. Respiratory rate saturation is fine. So our main concern is tachycardia, low grade fever. So that could be the reason for early, like sign of early sepsis or dehydration. Okay. Then Dr. Rabia did the very nice thing. She asked me about urine output chart. You should also ask about, can you please, when you asked about patient or nurse, like, do you have any abdo pain at this moment? Can you please point where is the pain? Either that pain is surrounding to that surgical site. And can you please rate it for me? One is the lowest pain and 10 being the highest pain. Then any short of breath, any chest pain, any funny feeling of your heart. Uh, so here our differential that could be expected diarrhea after right hemicolectomy, loss of ileocecal valve or bile salt malabsorption can happen. Antibiotic associated diarrhea, one of your differential, C. diff infection, anastomotic leakage, any like hospital acquired infection, electrolyte imbalance can give you diarrhea. Medication related, as I said, laxative, number one reason in hospital, and another reason it could be early small bowel obstruction. Okay, so all those are your differential. You don't need to say each and everything, but the important differential, please, you have to mention. Okay. So when you are taking history, I can tell you the key point. So key point in here, definitely history of presenting complaint details diarrhea question is the key point. Another thing associated feature is fever, abdominal pain is also your key point. Okay. Uh, then investigation and reason. So always we are going to do blood test. So blood test basically ABC. We are checking WBC and neutrophil for any sign of infection, hemoglobin, any bleeding, internal bleeding. CRP we are checking like any inflammatory changes or suggestive for infection. UEC, especially creatinine, EGFR, like we need to know about the sign of dehydration and also electrolytes as well. LFTs, lipase, you can check for any upper abdominal causes and blood culture if patient having fever. Okay. If ongoing diarrhea more than 4 stool, loose stool, you can send stool sample. So stool sample C. diff PCR, but it will take time. Okay. And also we can do stool MCH. But basically fecal calprotectin is not the first line. Fecal calprotectin we are only doing if you are suspecting for IBD. IBD is a chronic condition, so you don't need to worry in acute settings. Okay. Imaging, if you are worried about any small bowel obstruction, or if you are worried about any anastomotic leakage or any internal bleeding, you can order CT abdomen. But the first line investigation for bowel obstruction, you can always start with abdo X-ray. Okay. But if you are really worried patient hemodynamically unstable, then you can order CT abdo-pelvis. Initial management plan, that would be just a immediate supportive care. So if you're thinking your patient is dehydrated, you can start with IV normal saline. Correct electrolytes, you need to give proper analgesia, and strict fluid balance chart you have to maintain, and seize any laxative. If you are suspecting C. diff, you can start oral vancomycin, but not at this stage. So depends on the systemic feature as well. Okay. Um, So, and if you are suspecting any anastomotic leakage, definitely urgent surgical register review. That means you need to call your senior, ask for help. You have to keep the patient nil by mouth, start broad spectrum antibiotic coverage, and as I said, like CT scan needs to be ordered. Um, and if it's just a post-op loose stool, that could be expected. So you need to just reassure your patient, encourage hydration. That's it. Okay. Sometimes dietary modification needed, like low fat, small meals could help. So you can advise that one. So that's the case for post-op diarrhea.
Doctor, I have a query. Should I?
Ye- Yeah.
Uh, and as I have a query about fecal calprotectin. The history clearly mentioned that it is not a case of IBD, but
Mhm.
I have an important differential that is the IBD. And if the history did not give any clue about IBD, should I go mention fecal calprotectin when I briefly discuss about plan of management in this case?
In this case, you don't need to mention. I also mentioned in my note, like
Okay,
not a
okay,
first
okay.
line infection. And IBD, I'm not sure, like IBD could be your differential, but not a very important differential in this case. Post-op diarrhea, if patient gives you history about past medical history of IBD, you can think about flare up of IBD. Okay. But in this case, like you can tell IBD as your differential, but not a very important differential. And another important thing, if even though if you're thinking it's a IBD and if you want to order fecal calprotectin, still it will take at least 1 to 2 days to get the result back. Okay.
Okay.
So someone asked about sunken eyes. So for the adult, actually we don't check sunken eyes. That's for the peds. We are just checking dry mucous membrane, like heart rate, blood pressure. That's um, pretty enough for dehydration assessment for adult. Um, yes, definitely urine output you need to check. And very good thing Dr. Abdul mentioned, like whenever a candidate performed with me, please don't confuse the candidate. You don't need to comment. I know like you guys know like many candidate in here already middle of their preparation or almost finished of their preparation, but who is going to perform with me, so don't like confuse the candidate during that performance time. Okay, so when she or he finished, you can have your turn and you can ask the question or you can leave a comment.
Doc, when I asked you a question,
Yeah, yeah, sure.
yeah, about the blood culture, at what the temperature level should be considered to the blood culture? He's mild febrile now,
Yeah, so usually like in this case, if any temperature 37.5 or more, like you can send blood culture.
and what about the antibiotic vancomycin? What is the criteria to start, or just wait for the results?
I'm going to wait for the further result. You don't need to start vancomycin. And always remember AMC clinical is for the junior level exam. So in this case, if you want to start antibiotic, you have to call your senior. They will come and assess. And if they are suspecting it could be antibiotic associated diarrhea or it could be C. diff diarrhea, they need to stop the offending antibiotic and start vancomycin. But as a resident, you need to discuss with your senior to start antibiotic.
So in the management, we can say that, oh, I'm going to discuss the case with a senior about to start the antibiotic, or is that
Yes.
okay?
Yeah, yeah, yeah. So our initial management could be immediate, like all the supportive care, and you can mention like one possibility is it could be C. diff diarrhea. So in that case, I need to discuss with my senior. We are going to stop offending antibiotic, especially like ceftriaxone, making C. diff diarrhea worse. Okay, and we need to start oral vancomycin. But again, as I said, like all your management plan, you have to discuss with your senior.
Okay, thank you.
No worries. And another important thing, it depends on your time as well because you only have 8 minutes time. And in this case, if you have three tasks like history, physical examination, explain to the examiner, and initial like differential investigation, initial management, that means like for each and every task, like you will get only like 3 minutes, maybe like 2.5 or 3 minutes highest. Okay, so just use your time properly, and you have to think about like that's the important thing. When Dr. Rabia told me like she finished reading and she wants to perform, but always think about whole 2 minutes. And when you are thinking about 2 minutes, think about key point, important differential, and yeah, what point you should not miss in this case.
Okay, the
So,
one more question. This case history will be inside the room with the patient, or we are just memorize all the task and everything.
no, no, you don't need to memorize anything. So if you are a face-to-face candidate, so that STEM will be also given inside the room as well. So inside the room, there will be monitor, and
Okay,
yeah,
okay.
so you don't need to memorize anything. You will get that full like STEM in inside the room.
Oh,
Okay.
so there will be the same monitor like outside.
Yeah, yeah.
Okay.
But in outside, like the 2 minutes reading times, you are not allowed to write. Okay,
Oh, yeah.
so
Okay.
you need to just read and think. And inside, like when 8 minutes is started, then you are allowed to write. So whatever you want to write, you can write down on the paper.
Okay. But there will be the case, whole case will be there on the monitor too. So we
Yeah,
can
yeah.
look at.
Mm-hmm.
Yeah, that's good. Thank you.
Hello,
Okay.
doctor.
Yep.
Can I ask a question?
Sure.
What about the differential diagnosis? If there is a question about the differential diagnosis, like main and the differentials, do we have to explain about all the other differentials? Like why we are ruling out the other diagnosis or not?
So whenever you are mentioning like differential, so you can say like my first differential, it could be just an expected diarrhea after right hemicolectomy. And another differential, it could be antibiotic associated diarrhea because he is taking antibiotic. That could be possibilities. Another differential could be C. diff diarrhea, post antibiotic effect, anastomotic leakage. So you can tell like differential and one line to explain why you are thinking and why it's not. Okay. So
Okay,
it
thank you,
depends.
doctor.
Okay.
Thank you, doctor.
Okay. So let's move to the next case. Who wants to perform?
Can I can I participate?
Yes, yes, sure.
Thank you.
Okay, Dr. Valentina. So next case is yours, and 2 minutes reading time starts now.
Thank you.
You can start.
Okay, and hello, I'm the Dr. Estefania. Can you please confirm your name?
Hi, doctor. You can call me Jane.
Okay, nice to meet you, Jane. How can I help you today?
Doctor, I'm just feeling tired, and like last few days, I noticed like I'm having a lot tummy pain.
Tummy pain?
Hmm.
Okay, can you please point with your finger what exactly the pain is?
Just all over my tummy, especially like in lower side.
Okay, and for how long have you been with this pain?
Just last maybe like 2 weeks.
2 weeks? Is this the first time that you have this pain?
Yeah, it's not a pain actually, just a discomfort feeling.
It's just a discomfort feeling. Okay. And can you tell me what do you mean by discomfort? Like what exactly do you feel like?
It feels dull feeling, doctor. I'm not sure because I'm almost 36 weeks. Maybe just because of the heaviness or not sure, doctor. But
Okay.
feeling tired and feeling that
Okay.
pain.
All right. Does the pain goes anywhere else or just remains in your tummy?
Yeah, going to my back.
To your back? Okay. And do you think that that pain is associated with any food or with any position?
No, doctor, if I'm sitting, like I feel that pain. But if I'm lying down, I don't feel anything.
So it gets better when you are lying down.
Hmm.
All right. Do you from 1 to 10, being 10 the worst pain, how would you say the pain is?
Maybe 4 or 5.
Okay, that's good to know. And regarding to the tiredness, Jane, do you feel like maybe lack of energy or like feverish or how would you say that you feel?
Just lack of energy.
Lack
Not
of
feeling, no fever.
Okay, okay. And I understand that you have a 36 weeks pregnant. So far, are you up to date with your GP consultation regarding your prenatal conception care?
Yes, doctor.
Yes, okay. Did you get your back test at 36 weeks?
I'm due.
Okay. Did you already was the ultrasound by 20 weeks performed as well?
Yeah.
Everything was okay?
Mm-hmm.
All right. And the test of the glucose for checking diabetes was done at 28 weeks as well?
Yes, doctor.
Everything was normal?
Yes.
Okay. And all the tests and vaccinations were all done, right?
Mm-hmm.
And so far, do you have any symptoms, any bleeding for your vagina, any discharge?
No.
No, any vesicles in your private parts, any liquid from your vagina?
No, doctor, but
No?
I notice like something like is coming down like when I'm trying to pass poo.
When you're trying to pass poo, okay.
Mm.
Do you have any changes in your bowel movement? Maybe diarrhea, bleeding, mucus?
No, just a
No?
bit constipated.
Okay. And any changes in your urine, any burning sensation, any pain?
No.
No? Okay. Have you noticed that you are more pale than before?
No, doctor.
No? Okay. Any cough, any shortness of breath,
No.
any chest pain?
No, doctor.
No? Okay. Any so far any double vision, any problems with your speech?
No.
Any weakness in any part of your body?
No, doctor.
Okay. Any swelling in your legs as well? No?
Yes, doctor, my ankle they're swollen.
Okay, they are swollen. All right. And is in your both legs or is just one?
Just both leg, doctor, but
Okay.
also like that blood vessel are very prominent as well.
Is the swelling persistent during the day or it gets worse at any particular time?
Uh, Last few days, like it's all the time.
Okay, all the time. So, and you say that when you are standing up, the pain gets worse, and the pain is worse in the lower part of your tummy, right? Mm-hmm. Okay. Okay. Jane, do you have any past medical history that I should know?
No,
No. Any? Is this your first baby?
no, doctor is my third.
Okay. And so far, any complication in your last pregnancies?
No,
No. Okay. All of them was a cesarean or vaginal delivery.
normal vaginal delivery.
Oh, okay. And any family history with any problem?
No, doctor.
Okay. Jane, um, have you noticed any changes in the weather preferences?
No.
No? Okay. All right. Are you living with your husband at the moment? Or with the
Yes, doctor.
yes, is everything okay at home?
Yeah.
Do you have his support?
Yes.
All right. So, thank you, Jane. I'm just going to ask my examiner some few questions regarding your physical examination, and I'll get back to you shortly.
Mhm.
Examiner, can I know the general appearance of my patient? Is she pale, cyanotic, signs of dehydration, any lymphadenopathy, erythema?
No.
Okay, the vital signs, including the BMI.
So BMI 24,
Okay,
vital sign blood pressure 120 by 80, heart rate 82 beats per minute, respiratory rate, saturation, temperature, all are fine.
okay, and a quick cardiovascular examination,
Normal.
a respiratory physical examination.
It's a clear breath sound bilaterally.
Okay, and tummy abdominal examination. Is there any visible mass?
No.
No. Can I know the fundal height of my patient?
According to the gestational age,
Okay, and the fetal heart rate?
140 beats per minute.
Okay, and can I know the lie and presentation of the baby?
Longitudinal lie and cephalic presentation.
Okay, and can we do a neurological examination? Is there any hyperreflexia or any motor or sensory deficient?
So neurological examination, you will get reflex bilaterally 2 plus and clonus 1 plus bilaterally, no neurological deficit.
Okay, and can we do the office test, a urine distich, any proteinuria?
It's a pending.
Is it pending? And blood sugar levels as well?
5.8.
Okay, so you say that she has a hyperreflexia, right? And clonus.
Reflex 2 plus bilaterally, clonus 1 plus bilaterally.
Okay. All right. And can we do a quick okay, right, now. So thank you, examiner. I'll be back to my before of that can fundoscopy, is there any changes?
Fundoscopy not done, but you can perform.
Okay. Examiner, I'm looking for any papilledema.
Sure, your
All
time.
right. Okay. So thank you, examiner. I'll be back to my patient. Jane.
Your time, Valentina.
Oh my God.
It's a very long history, you too, but your performance was very fantastic. Like history, how you took that history, that was really nice. But what I noticed, like you spend a lot of time taking history and then physical examination. Okay,
Right.
so I'm just asking, like, have you booked the exam?
Yes, it's going to be on March.
Oh, okay. So you only have 2 months. Now your main focus, because what I noticed, like when you perform, I can feel like your preparation is at this moment almost maybe finished or something. But so at this moment, my suggestion would be you need to focus on time management.
Okay.
Okay. And how you need to avoid unnecessary question. Like you asked me about partner question. Definitely that is important. But in this case, what you can ask, like you can say, like, do you have enough support in your family? Okay. You don't need to ask like 3 or 4 sentences, like it just wastes your time. Okay.
Okay.
And you asked me like couple of other question as well. Um, at this moment, like when your main focus, like patient complaining about tummy pain and tiredness feeling and third trimester complication, which you already asked, that was fantastic. And rather than asking like all one by one question, like antenatal question, you can save your time. For example, you ask me about sugar test, like anomaly scan, like those things. You can ask like, so far, are you up to date with all of your scan and blood test? Any abnormalities, okay? Like that. You can save your time. Coming to the physical examination, so in here, I know like you are looking for any preeclampsia symptoms like that. So you asked about fundoscopy, and I told you like it's pending. That means like you need to move to the next task, okay? So if any like if fundoscopy already done, you will get like findings from examiner, okay? You don't need to tell your examiner like I'm looking for like fundoscopy, like what you are looking for. If it's a pending, just move to the next. Okay.
Okay.
Then as I said, like your history taking was really nice. I didn't notice like you missed any question, but you asked like so many question. So what's your differential in this case? What do you think?
My differentials, because she's complaining, but I mean, like based on the physical examination, preeclampsia would be on the top of my list. But also, I'm thinking in an iron deficiency anemia and any ac- any acute abdomen pain comes to my mind. Also, I'm not thinking in premature rupture of membrane because no leaking or any preterm. I mean, like she's
Mhm.
36. Um,
Okay.
yes, and then all the differential for tiredness, which be atypical pneumonia, infective endocarditis.
Mhm.
Uh,
So
yeah,
So you were thinking about like when you told me about preeclampsia, very nice differential because you found pitting edema. But have you noticed your patient blood pressure is fine?
yes, it's fine. Yeah,
Okay.
yeah.
So there could be possibilities preeclampsia, but the sign, like all the other symptoms, except for that bilateral ankle swelling, everything is normal. So you can think about preeclampsia. What else? You told me about preterm labor. That is also less likely in this case because patient didn't complain to you any discharge, any PV bleeding, anything. And now you told me about atypical pneumonia, those things. But if you're thinking atypical pneumonia, did you ask me about any cough, short of breath?
Yes, I
And
did.
you did, okay.
Yeah,
And how about like chest pain? You told me about infective endocarditis, any chest pain,
yeah.
palpitation things.
Yes,
So
I asked you.
there could be possibilities, but very less likely in this case, okay? This is the case of pelvic congestion syndrome. Have you heard about it?
No, pelvic
Okay.
condition syndrome. No.
Yes, and that is like it's a very recent case that are coming, okay?
Okay.
So let's discuss the case. 37 years old female Mrs. Jane Doe present to the antenatal clinic reporting a persistent feeling of tiredness over the past few weeks, and she is 36 weeks pregnant. So your task is take a history of presenting complaints and obstetric history, physical examination finding from examiner approach of management. Okay. Um, in here, you can start asking about ops history, or you can ask about history of presenting complaint. So here, ops history. This is her third pregnancy. Her previous two pregnancy were uncomplicated. Both deliveries were fine. And medical history, no other medical condition. Um, she doesn't have any chronic medical condition either. Um, no surgical history. She also has a regular antenatal checkup, no major complications so far. So the symptoms is fatigue for several weeks and also increased discomfort from varicose vein. I told Dr. Valentina about that engorged vein on the lower leg and also hemorrhoids things I told, but she completely ignored that one. Pelvic pain, I mentioned, like that is the lower abdominal pain, and that is the dull type of pain worsening in the evening and after prolonged standing or sitting. She's only taking just multivitamin and supplements, but social history like unremarkable, and a systemic review like no headache, no visual changes, no chest pain, short of breath, like no other symptoms at all. Okay. Um, so physical examination findings, she looks well but looks a bit tired, vitally stable. Cardiovascular, respiratory, abdominal examination are pretty unremarkable. Then lower extremity examination, so there is a varicose vein noted bilaterally, and also mild pitting edema around the ankle. When I told about like something coming when I'm trying to pass poo, that means like there could be hemorrhoids or just say external hemorrhoids. So you can ask about doing digital rectal examination, or you can just do a inspection. So basically it's the external hemorrhoid, but no signs of thrombosis. Neurological examination is also okay. So yeah, this is the case based on the symptoms and findings. This is the case of pelvic congestion syndrome. Other differential, it could be anemia because of the tiredness feeling. Thyroid problem, chronic venous insufficiency can cause those symptoms, or it could be just a normal physiological changes of third trimester of pregnancy, including tiredness, fatigue, varicose vein, and hemorrhoids. Okay. Um, but your primary diagnosis, like most likely diagnosis, is a PCS. And why we are thinking it's a pelvic congestion syndrome? Because he's complaining about lower abdominal pain worsening with prolonged standing, and also if you're asking about this pain is new, or she actually got this pain prior to her pregnancy as well. So it's a chronic pelvic pain, and multiparity one of the risk factor. Um, so those are the positive findings for pelvic congestion syndrome. Okay. What we can do for management. So investigation you can do, just check a bloods to check anemia, thyroid function, Doppler ultrasound of the pelvic and lower extremity to exclude any pelvic vein, and also assess the severity of the varicose vein as well. And you need to rule out any DVT. So you can do Doppler ultrasound of the pelvis and lower extremities. Then symptomatic management, if patient feels fatigue, you can encourage like regular light exercise, adequate hydration, nutrition you can mention, and enough rest, proper sleep hygiene. Then varicose vein you can advise for compression stocking. Then suggest for avoid prolonged sitting or standing. But very rarely we prescribe medication, so you don't need to remember the name. Just a supportive management. And if patient complains about hemorrhoids or constipation, you can offer like dietary fiber, fluid intake to prevent constipation, or sometimes like you can also suggest for laxative use or stool softener. Okay. And for hemorrhoids, external hemorrhoids, you can advise like topical treatment like hydrocortisone cream or cis bath can also help for symptom relief. Then monitor and follow up, usually like regular antenatal visits, checking blood pressure, fetal well-being, and also you need to educate and reassure mother, and preparation for the delivery. Okay. So that's the case of pelvic congestion syndrome.
One small question. Uh, in pregnancy, it's like common to get hemorrhoids and then lower limb edema and sometimes like varicose. So how are we going to like exactly say like whether this is a normal a part of the pregnancy process or pelvic congestion syndrome?
So as I said, like all are the associated symptoms like hemorrhoids, the varicose vein, or like ankle edema. But here, patient main complaint was tiredness and like lower abdominal discomfort or pain. Okay. So, and if you are asking more history, so patient has actually history of chronic pelvic pain, and that multiparity is one of the risk factor for pelvic congestion syndrome.
Okay.
And also, Doctor, you mentioned that 2+ reflexes bilaterally and 1+ clonus.
That is pretty normal.
Okay.
Regarding anemia, should not we take dietary history? Yes, you can take a dietary history if you have like enough time. So if you're thinking about anemia or any bleeding, you can ask about can you tell me about your proper diet, or like your diet includes proper leafy green leafy vegetables and red meat. So you can ask quickly, okay? It depends, like as I said, like how we were managing with time. You can ask lots of question to get to know your diagnosis and differential, or you can ask quickly, just rule out and rule in that is screening question. Yeah, UTI can also be a differential, so in that case you should always ask about bowel bladder question, okay?
Thank
Okay,
you,
so
doctor, for your.
no worries. So let's move to the next case. Who wants to perform?
Can I give a try?
Yeah, what's your name?
And
Indomini? Okay, no worries. This is your case and your 2 minute starts now. Okay, so you can start.
good morning. I'm Dr. Indumini. How can I help you today?
Hi, doctor. I'm here for just my hip operation. Like they did some couple of investigation pre-op check. Just here for follow-up appointment. Just for the result.
Okay. Okay, Elizabeth, thank you for coming to talk about this. So don't worry, I'll explain everything to you. So, would you mind if I ask you a few questions before I explain about the report?
Yes, doctor.
Mm-hmm. Okay, so can I know for how long have you been having this joint problem?
For many years, doctor, but last 1 year is getting worse, especially my right side of the hip. It's very painful, doctor.
Mm-hmm. Okay, I can understand. So, can I know, have you been having loss of appetite over the past few years?
Um, I've been always a fussy eater, doctor. My body weight is always like 50s.
Mm-hmm. Have you noticed any weight loss over the past time?
No,
Mm-hmm. Okay, so have there been any have you been up to date with your cancer screening, especially the bowel cancers?
I did one time check, but I think that was normal.
When was it?
3 years ago?
Okay, okay. So what about have you done the mammogram as well?
Yes, doctor, one time.
When was it?
A few years ago, I can't remember when that was.
Mhm. Was it all right?
Yeah,
Mm-hmm. Okay, so have there been any personal history on you or any family member who had been diagnosed with any type of cancer?
my mom has a history of breast cancer.
Uh-huh. Okay, so what age was it diagnosed?
Um, Maybe 60?
Mm-hmm. Okay, so can I know, have you noticed any breast lump in you?
No, doctor.
No. Okay, so what about your bowel habits? Is it all right?
Yes.
Any blood in stools or any problem like that?
No, doctor.
Okay. So, then do you have any cough?
Yes, doctor, I do have cough.
So,
Just
for how
literally.
long have you been having?
For a long time.
Okay, so was it for months or years?
Yeah, years.
Okay, is it a chesty or a dry cough?
Just a dry cough.
Dry cough, okay. Have there been any episodes of blood with the coughing?
No.
No, okay. So, have you been given any medication for that?
No, doctor.
No, okay. So, can I know, is it the cough was at night or during the daytime?
It's anytime.
Okay. Do you smoke?
Yes, doctor.
Okay. So, for how long have you been smoking?
Pretty much all of my adulthood.
Okay. So, how much do you smoke?
It depends, doctor. If I feel stressed, I smoke like 2 packs a day.
Mm-hmm. Okay. So, have you ever tried to stop smoking or get help for that?
No.
Mm-hmm. What was your occupation?
Am I a retired teacher?
Sorry, I couldn't hear.
Am I a retired teacher?
Oh, okay, retired teacher. Okay. Um, okay. So, have you noticed any yellowish discoloration in you?
No.
No. Okay. Any abdominal pain?
No.
Mm-hmm. Okay. So, are you taking apart from this hip problem? Do you have any other medical conditions?
Um, no, just say that joint pain problem,
Mm-hmm.
doctor.
Okay. Okay. So, was there any abdominal pain on you at any
No.
point?
No.
Mm-hmm. How's your urine? Is it okay? Urination?
Yes.
Uh, mhm. Any blood with it?
No.
Mm-hmm. Okay. So, okay. So how are you feeling now?
I'm okay, doctor.
Mm-hmm. Okay. So, I have the report, one of the reports which we did before going for the surgery. So would you mind if I explain about that to you?
Mm-hmm.
Okay. Um, X-ray.
So X-ray report already in the
Yes. Okay. So
and there is the
yes.
picture, but picture is difficult to understand because of the color.
Okay.
You can explain
So,
further.
okay. So, Elizabeth, according to this is a chest X-ray. So, from white you can see those are the bones, and black color is the air. And usually we see soft tissues as white. So here you can see in the middle it's the heart shadow. And we have done X-ray, and that in that we have found that there's a fracture in one of the bones of yours. So yeah, so the radiologist have reported this as it could be a fracture. So mostly, since you don't have any history of fall or anything, they are suspecting whether it could be due to some cancer in you, but we are just suspecting for that. Don't worry at the moment. We will have to further investigate on that and see what is causing that, whether it's actually cancer related fracture or not. So we will investigate on that. So I think at this moment, because of this, the best thing is to like till we sort out that this fracture problem, we will delay your surgery for some time. How are you feeling about that?
So, doctor, you told me about that radiologist suspected about cancer. So,
Yes.
what do you think? Do I
So,
have
like,
cancer?
yes, according to your history, I found that you've been having like a dry cough for a long time, and then you have been smoking a lot. So I'm afraid whether like it could be something like lung cancer which is causing this. But uh, in the X-ray, usually we can see if there's any changes like that. But for further confirmation, I would suggest like whether we can do something like a CT scan for our confirmation. So for that, for this management, I think because of this suspicion, I can refer you to our cancer center to sort this out. But at the moment, with this fracture, I think the best is to like to postpone the surgery for now because it can lead to like problems, like especially we have to give anesthesia and all, and then this can cause
Your
some
time's
problem.
up, doctor.
So,
Like,
okay.
very nice performance, Dr. Indumini. Especially like history, you took the right history and you already um, you mentioned about patient smoking history and also dry cough. Like those are the key point in here. And another thing, like you try to rule out bowel cancer, breast cancer. That was fantastic. What I noticed the missing point in here, like osteoporosis things. You didn't ask me any osteoporosis risk factor things because that radiologist reported it could be pathological fracture. Definitely, like they're concerned about any secondary deposit or cancer things, but osteoporosis another differential. So basically, in this case, pathological fracture differential, like it could be trauma, secondary deposits, multiple myeloma, or osteoporosis. Okay, so you already asked me all the cancer, like primary origin and like secondary deposit things. You already asked me that things, trauma history you did, but osteoporosis, those are the missing things. Otherwise, like
Okay.
how you explained, that was fantastic. Okay. And the missing point was management. You need to mention about it's a multidisciplinary team approach and what we are going to do. I think it's just about the time. If you will get time, you can finish. Okay.
Thank you.
No worries. Have you booked your exam?
Yes.
Okay. All the best.
Thank
So
you.
let's discuss the case. GP clinic, 58 years, Elizabeth came for pre-op checkup. So pre-op patient is scheduled for hip osteoarthritis surgery. Chest X-ray showed there is a fracture in T5 and radiologist reported that pathological fracture secondary to quarry cancer suspected. So task is take a history from the patient, explain X-ray to the patient, explain implication of findings and management. So those are the radiological images. You can comment on it. And so before explaining how Dr. Indomini approached, that was really fantastic. So she told the patient that before explaining the result, I'm going to ask you a few more questions so that I can correlate with the result. Is that okay? So introduce yourself, show empathy to your patient, ask or offer any pain medication if your patient is having any pain. Okay. Ask about hip surgery, when that is booked for that surgery, any concern regarding surgery, ask about any trauma, fall, any cancer history, like any loss of weight, loss of appetite, any lumps, bumps in the body, any weakness, numbness in the arm or legs. Then ask about your bowel motion, any blood in it, any alternative diarrhea, constipation, how about your water works. Then talk about like any chest pain, short of breath, palpitation, cough, any blood in the cough, then tummy pain, as I said, PR bleeding, alternative diarrhea, constipation. Then any headache, dizziness, blurring of vision, back pain, spine pain problem. Um, are you using any pain medication? Um, then osteoporosis question. So tell me about your diet. Do you take dairy products? Do you do regular exercise? Social history like smoking. If she's a smoker, ask details about it. Drinking, then past illness. Do you take any regular medication, any supplement? Ask about period question. Like any hot flash, mood swing, PV bleed. If it's a male person, ask about BPH problem or prostate cancer question, because prostate cancer also metastasize to the bone. So ask about it. Then history of cancer in the family or any previous cancer history to the patient, any blood related cancer, ask about it. Social history. Okay. Then explain the X-ray. So we have done a X-ray of your lower back. That is, you can explain that spine is made of a lots of small bone. We call it vertebrae. Okay, and that small bone placed one on the top of the others with a space in between. Okay. So what happened? Like all these vertebrae should be of equal height, but in your case, like that number T5 vertebrae, it looks fractured. So radiologist commented on that and they thought it could be pathological fracture, and the reason behind it, it could be any suspected cancer history. Okay. And other possibilities, it could be fall trauma, but you told me there was no history of fall trauma. Another thing, it could be like cancer origin from one side and then spread to the bone. We call it secondary deposits. There could be one possibilities. Another possibility could be osteoporosis. Okay. But I'm really concerned about suspected cancer, and I'm thinking your symptoms suggestive for lung cancer. So why I'm thinking that? Because you are having dry cough for a long time and you are a smoker. So those are the risk factor for having lung cancer, and that lung cancer actually is spreading to the bone. Okay. Other differential could be oral cavity cancer, like nasal cancer, esophageal cancer, thyroid cancer, or any cancer of the gynecological part, like kidney cancer can happen. And risk factor, as I said, is smoking, alcohol, family history, trauma, or diet, or genetic or any environmental factor. Okay. So complication, you don't need to explain, but you can say like there could be possibilities nasty growth to the organ or plasma cell, like blood-borne cancer, and that can spread to the other parts of the body. Okay, and if it's a osteoporosis occur, the major complication can happen, like you might have that fracture with very minimal trauma, and if that fracture sustained at this age, it might take a long time to heal. Okay. So the immediate management, we need to confirm the diagnosis first. So diagnosis, we need to do blood test, X-ray, CT scan, and or PET scan, okay, or MRI scan. And then management, if cancer confirmed, so you will be managed by multidisciplinary team approach. So including surgeon, cancer specialist nurse, support group, and me as a GP. Okay. If any suspected mets or find out the primary, we need to do biopsy. Okay. And then a specialist will decide to do further assessment for primary or mets, staging, doing more blood tests, CT scan or images, and then surgeon will decide upon the surgery or like chemo radiotherapy, like that. Okay. And follow-up plan as well. I know all those information are really overwhelming for you, but I'll provide you the reading materials. As you already booked for elective surgery, I will also let the orthopedic surgeon know about that one, and they will decide either proceed with the surgery or defer the surgery. Okay. And I will do further investigation to confirm my diagnosis. Long-term management, lifestyle modification, vitamin D, calcium supplement, psychological referral or support group is very important, and fall prevention. And just you need to offer like support to your patient and provide reading materials as well. Okay. So that's the case for pathological fracture. Yes, kind of like Breaking Bad news case, but it's not confirmed yet. You are suspecting, okay?
Excuse me, doctor. So in terms of management in the fracture implication on management, so do we say that we postpone the planned
So
surgery,
that
or do we?
management is explain implication of findings and management. That means like because it's an elective operation, so your job is to let the surgeon know about the findings. It's a T5 pathological fracture, and then
Mhm.
surgeon will decide either they will go ahead with the surgery or they will defer. Okay.
So we're not talking about the oncologist. I will refer you, or I will talk with the oncologist or things like that.
So as a GP, your job should be like to confirm the diagnosis first, and you already mentioned about it would be multidisciplinary team approach. For that osteoarthritis like hip replacement surgery, you are letting the surgeon know that there is a pathological fracture. Are you talking like this?
Mhm.
Do you get my answer or like do you have
Yes.
any confusion?
Yeah. Thank you.
And regarding that suspected cancer, you are not sure whether it's a cancer or other reason. So your first job to do further investigation, including blood test and scan, like either CT scan or PET scan. Okay. And you already mentioned like it would be multidisciplinary team approach. So once the diagnosis is confirmed, then if that primary is lung cancer, definitely you need to refer that patient to the surgeon for operation, and at the same time you need to refer the patient to the cancer specialist as well. Okay. Okay. So let's move to the next case. Who wants to perform?
Hello, doctor. Can I do the next one?
Yeah. So this is your case and your 2 minute starts now. You can start.
Hello, I'm one of the doctors today here in the emergency department. I'm Dr. Bora. May I confirm your name and age, please?
Hi, doctor. I'm Jenny, and I'm 28 years old.
Hello, Jenny. Nice meeting you. And from your notes, I came to know that you had some motor vehicle accident, following which you were admitted to the hospital. And how are you feeling today?
Terrible, doctor. Now, doctor, I'm having severe tummy pain. Can you tell me, doctor, what's going on? I'm really
Yes,
scared.
yes, definitely. I'll be happy to help you. So first of all, from your notes, I came to know that you had some multiple rib fractures on your left side of the chest, along with some injury, that is trauma to your organ in the tummy, which is called spleen. Okay, and doctors decided to manage you conservatively. So can you just tell me in short, since how long this pain is increasing and on which side of yours, like on the right side or on the left side?
It's mainly on my like upper tummy, doctor, and more on my left side.
Okay,
And like last maybe last 1 hour, like the pain is getting worse, doctor.
okay. So you told me it is in the upper tummy. Is there any radiation of the pain? And can you rate me the pain out of a scale of 1 to 10?
It's almost like 10 out of 10 pain now, doctor.
Okay, so first of all, let me arrange some painkillers for you. Is that all right?
Mm-hmm.
So, dear examiner, first of all, I will make my patient stable. I will provide some painkillers to the patient, and once she is stable, I will proceed with them with my next task. So, can I proceed with my task,
Mm-hmm.
examiner? Okay.
Yes.
So, yes, I'd also like to know your pain. And do you have any other associated symptoms along with it, like, any nausea, vomiting?
Yes, doctor, I already vomited one time and feeling nausea constantly.
Okay. Did you notice any pieces of blood from along with your pee or poo, along with this
I haven't passed any urine like since I came.
until now? Okay. Do you have any difficulty with respiration and breathing also after following this motor vehicle accident?
Yes, doctor, feeling short of breath.
Okay. Are you feeling pain on your chest also, particularly on the left side?
Yes.
Okay. Did you had any racing of the heart or any shortness of breath?
Yes, doctor.
Okay. And I also wanted to know regarding your pain. So, following your motor vehicle accident, did you had any loss of consciousness or something like that?
Um, During the accident, yes,
Yeah.
doctor.
Okay. And do you remember, like, did you regain your consciousness by yourself or after coming to hospital?
Yeah, by myself.
Okay, okay. Thank you for all the informations. Now I would like to look for the observation charts in the room, which is available for the patient. So first of all, I'd like to look the input-output chart and the vitals of the patient. Thank you. Thank you, examiner. So now I would like to explain the possibilities to you. So this is your chart. As you can see, we have your vitals in the chart. Like we monitored your heart rate, your pulse, your temperature, and also your blood pressure throughout the day on the different timings from the morning to the afternoon and evening. So we observed that your blood pressure has been a bit reduced in between. Like it was initially 100 by 60, and later it was reduced to some 100 by 62, and later in between it was reduced to 98 by or 96 by 60, and again it was on 100 by 64. Then heart rate was also increased to some extent, which in the medical terms we call it tachycardia. It is 110 for you. And but the one of the good thing is that your saturation of oxygen in your blood is normal, which is 98 in the room air, which is a good news. And regarding your respiratory rate, it is slightly high, which in the medical terms we call it tachypnea. And your pain was scored to be 5, which was reduced later, and your GCS score is good. That's why you are doing well. And your temperature, core body temperature is normal, 36.7. So, from your chart, most likely, since you had a motor vehicle accident, so these may be the possibilities. Like, first of all, there may be some internal organ injury and bleeding. Like, we have some solid organs inside the tummy, like the liver, like the spleen, those things, and the gut also. So, sometimes if there is any trauma following an accident, and also you had multiple rib fractures, so there may be trauma to the lungs also. So, if there is any internal bleeding of the organs inside our body, sometimes these can be the presentations like hypotension, as your blood pressure is also reduced to some extent. You have tachycardia also, which is the increased pulse rate and the heart rate. You have tachypnea also, that is increase in the respiratory rate. So, these are the signs that I am worried about you. Maybe some indicators of internal hemorrhage. Okay, are you so far with me?
Yes, doctor.
So sorry to say about that, but but you are in the good hands, and you will be taken care of by a multidisciplinary team. Okay. So we already did the CT scan of the abdomen. In the CT scan of the abdomen, they found some multiple rib fractures on the left side, and they also mentioned that your spleen, the organ on the left side of your tummy, there are some lacerations. So there may be some possibilities that there is still some internal bleeding around the spleen, or because of the injury to the spleen, or there may be a splenic hematoma also. We call it hematoma in the medical terms. So we'll have to do some further investigations, and uh, I will liaise with the multidisciplinary team. I'll have a consultation with them. You may need some more investigations to rule out if there is any internal bleeding or something like that, and accordingly we'll have to manage you. Okay, because I observed that even after starting the IV drip, your blood pressure has not been stabilized much. It is still like 100 by 60 or something like that. So from my side, I will liaise with the multidisciplinary team, and they will do some further investigations. If required, they will repeat the investigations like CT scan to rule out any internal hemorrhage. And if required, they can also to see if there is any accumulation of blood inside your tummy or something like that, and also to rule out any injury to the internal organs. So these may be the possibilities. Do you have any questions so far, dear?
So, what management you are planning to give me, doctor, next?
Yes, as I told you, I'm going to liaise with the multidisciplinary team. You will be taken care of by the surgeon, by the senior registrar, and maybe by the gastroenterologist. And if there is any internal organ injury, maybe I will refer you to the surgeon, and they may decide for you for surgeries to drain the blood
Your
inside.
hands up, doctor.
Yeah, to drain the blood inside your tummy, or maybe if the your hemoglobin is reduced or blood pressure is not controlled, they may also decide for some blood transfusion after doing the baseline investigations and the blood grouping and cross matching, and they may also decide
Your
some
time's
surgeries
up.
for suturing. Thank you,
No
examiner.
worries. Very nice performance, Dr. Bora.
Mm.
Have you booked your exam?
No, doctor.
Not yet.
No,
You
I
should book.
tried, but I could not, doctor.
Okay, but your performance was really nice. Like how
Oh,
you explain the possibilities. I was just listening. That was fantastic.
thank you, doctor.
Just a couple of things you can add. Just when you are explaining to the patient in between, always check your patient understanding.
Yes,
Otherwise, like it would be like just a one-way conversation.
yes, doctor.
And the second thing is that you mentioned about that management part, multidisciplinary team approach in here, but it's
Yes,
basically you are just involving your senior and that surgical register.
yes,
They should come and like rethink about to take the patient to the theater because you are
yes,
thinking now it's a bleeding
yeah,
occur.
yes,
And you need to talk about like splenectomy things.
yes,
That is the
yes,
missing thing.
yeah,
Okay.
yeah, yes, doctor.
Otherwise, like how you explained that was fantastic.
Yes, doctor. I just tried, doctor. Thank you.
No, that's fine. So let's discuss the case.
Thank
28
you,
years
doctor.
old. No worries. So 28 years old female met with an accident and the car crashed into her car from side and patient was retrieved, brought to the ED primary survey done and reviewed by surgical team. CT abdo found to have multiple rib fracture on the left side and also splenic laceration. So initially decided to manage conservatively. 3 hours later, patient complain about increasing pain and you are asked to review the patient. So observation chart you will get, and currently patient is lying on bed and drip is running. So task is explain the possibilities to the patient and counseling accordingly. So here you can, so always in here key point is check hemodynamic stability. Okay, if patient unstable, so you can follow DRS ABCD protocol. Um, so you all know that I would like to secure a IV cannula, take some blood sample for all the initial bloods, especially ABC blood group and hold UAC CRP, and start him, or you can start giving bolus IV fluid. Okay, and constant monitoring. So you can introduce yourself. You can say, "Hi, I'm X, one of the doctor here. I'll be looking after you. I'm so sorry to hear about your incident. Are you in any pain at this moment?" So if your patient complaining about severe pain after ruling out any allergies, you are going to offer her strong pain medication. Okay, and then explain like, look, Janice, based on the observation chart, it seems like your blood pressure is falling down and your heart rate is going up. What does it mean? It means that your heart is working faster. I'm really a bit concerned about these changes because it indicates you are losing some bloods internally. Okay. I'm attaching you IV cannula. Take blood sample, start you IV fluid, or like if patient already having maintenance fluid, you can give just a bolus fluid. Okay. And in the meantime, I will inform my registrar to come and see you. So let me assure you that you are in safe hand, and we'll try our best to give you the best possible care. Okay. So talk about the cause of the bleeding. You can say like, Janice, the bleeding could be from anywhere in the body. It could be injury to the lungs, spleen, or any body organ or gut. Okay. Because you have an accident and that CT scan showed that you had multiple rib fracture, and also like that spleen, one of the organ in our tummy, that also has some laceration as well. So I'm suspecting you might have bleeding from that organ. Okay, so what could be the management plan regarding rib fracture? Usually rib fracture management is conservative unless symptomatic. Okay, so basically pain management with pain killer, and we need to monitor any short of breath, cough, to rule out any pneumothorax. Coming to the splenic laceration. So spleen is one of the organ that basically located left side of our tummy, and it is the part of our immune system. Okay, it has multiple roles, like it filters our blood from old RBC, helps fighting against the infection. So, and it is very prone to injury during that blunt or penetrating trauma. Okay. Um, so initially, when they found laceration on that uh, CT scan, they are planned to keep that things for observation, as there is a chance of bleeding to stop itself. Okay. In your case, the bleeding recur and make your condition unstable. That means your blood pressure going down and your heart rate going up, and also you are complaining about severe tummy pain as well. That's why like our plan is to take you to the operation theater for immediate like removal of the spleen possibility. We call this condition is a splenectomy. Okay, they might decide to do some images as well. Okay. So splenectomy, that surgery, either that would be the keyhole operation or open, and it is performed under general anesthesia by experienced surgical staff. And any surgical complication can happen, like infection, bleeding, injury to the other structure, risk of anesthesia can happen. Okay, but don't worry, your surgery will be done by the experienced staff, so complication will be unlikely. And long-term management, as I told you, is spleen one of our important body part that fight against the infection. So body can live without spleen, but it helps to fight the infection. So you will be at high risk of catching infection. So what we are going to do, after removing spleen, you will be given vaccine for pneumococcal, influenza, and hip, and also will give you long-term antibiotic. Okay, and you have to be careful when traveling as well. Other complication are clotting problem, and you might stay in hospital for a while as well. But based on the specialist advice, we'll update you time to time. So that is the splenic laceration and unstable patient. Yeah, basically it's a counseling case. You don't need to take a history in this case. What you can ask like a question in between. Like you can ask like, how bad your pain? I can offer you pain medication, like those things. Okay. Uh, okay, so let's move to the last case. Who wants to perform?
Hello.
Hello, Dr. Riyazat. Do you want to perform?
Okay, ma'am, I will try.
Okay. So this is your case, and your 2 minute starts now.
Okay, ma'am, I'm ready.
You still have 1 minute, so think about the
Okay,
case, okay?
okay, ma'am.
You can start. Hello,
Uh,
doctor. You can start.
okay, ma'am. Hello, I'm Dr. Rajat here, one of the doctor in this team in this hospital, and I will have some time with you, and I will have some discussion. Can I know your name and age, please?
Hi, doctor. I'm Jenny, and I'm 18 years old.
Okay. I have seen your files, and I came to know that you have diagnosed with the diabetes and one of the complications of the diabetes, and you were admitted in this hospital, and now you are ready for the discharge. And I'm very sorry to hear for that, but I'm still the same time happy that you have been managed well, and now you have been discharged from this hospital. And I will ask some questions. Are you okay with that?
Yes.
Okay, first of all, tell me that when you came to the hospital, what symptoms and what was the problem with you?
Um, I felt dizzy and yeah, feeling sick.
And can I know that from how long you were having all these symptoms like feeling sick and dizzy and light weakness or something like that?
2 to 3 days maybe.
Okay. And before that, any other problems like the flu-like illness and fever or respiratory or cough or something before coming to the hospital?
No, Dr. Riyazat, your voice is not clear.
Okay, madam. Are you listening now?
Yeah.
Okay. I was just want to say that do you have any other problem when you came to the hospital, like flu-like illness or cough or fever before coming to the hospital?
No.
Okay. Uh, okay, that's good. And when you came to the hospital, before that, what you were doing in that days? Like you were studying or you were on the vacations or something like that?
No, I was at home.
Okay. Okay, I would like to ask some more questions. Are you okay with that?
Mm-hmm.
Okay. Before coming to the hospital, do you feel any loss of consciousness or shortness of breath or any other serious problems like nausea or vomiting or abdominal pain?
Yeah, I feel like tummy pain, feeling nausea. I vomited a couple of times and I felt dizzy. Then I called my mom and my mom called ambulance and they found my blood sugar was really high.
Okay, very much for that. Okay, some more questions. Do you have any problem in the past, like any blood pressure or any heart problems or any kidney problems or something that you were taking some medications for any illness?
No.
Okay. Do you have any allergies in the past?
Was that?
Allergies.
Oh no.
Okay. Any diabetes problem in your family, like from father side or from mother side or in your brother or sisters?
Yes, my mom also has diabetes.
Okay. Do you smoke or alcohol? Taking alcohol?
Just vaping and alcohol occasionally.
Okay. And you are doing all the exercise whenever you have a time, and your diet was well before that.
Sorry, doctor, your voice is not clear. What was your question?
Uh, about diet and
Mm-hmm.
exercise.
Mm-hmm.
How was your diet and exercise plan before you come to the hospital? Are you going daily for the exercise and or sometime?
Yeah, I do exercise.
Okay. Okay, thank you very much for your all information, and I have gone through your file, and I will a bit explain to you what was your condition, and it is called diabetes type 1, and what you had in the hospital, it was a complication that diabetic ketoacidosis is one of the very serious kind of a complication of the diabetes when your sugar is very high and in terms of your age, you are very young, and most probably it was the type 1 diabetes, and it can happen almost in the type 1 when the patient don't know, and their sugar is very high, and they came to know in the hospital whenever they have a very serious problem like you have. So I'm very happy that you are now okay, and so we are going to discharge you today. And further management plans, as we have that you have been diagnosed with the diabetes, and it's in a way, like you have to be very careful at home, and so you need to check your blood sugar levels in the fasting and in all of the meals. And with our team and specialists in our hospital, we will give you the discharge card, and so that will be your task to manage your blood sugar at the home. And
Anything else, doctor?
we will prescribe some medications, and you will have to take and proper time, and so you should be very careful with your diet and the management plans of the drugs. and you will be called after shortly after 1 week to the hospital for the recheckup. And if any problem at home, like you will have any serious problem like vomiting, abdominal pain, fever, or loss of consciousness, and you are advised to take uh, one of your friends or something, parents with you, that you will be in the hospital at the right time and you will have to manage. Hopefully, it will not happen, but you will have to be very careful for that. Thank you.
Okay, Dr. Riyazat, nice performance. In this case, what I noticed, like when you asked me question, like all question you asked like together, so it's very difficult to remember and answer the question. What I told my first like case when I explained, don't ask all the question at a time, okay? So
Okay,
try
madam.
to break down the question. Like you can ask like, can you tell me what was the symptoms? Were you feel dizzy that time? Just a highest two question at a time, okay? But if you are asking like all the question together, like you might lose the answer, okay?
Okay.
Another question, another things, unfortunately, your voice was not clear, so some question I might miss. So this is diabetic ketoacidosis counseling case. The underlying problem is bulimia nervosa, patient having eating disorder issues. So you didn't dig more. Why patient coming with diabetic ketoacidosis? Like you asked me about fever, flu symptoms, those things. That fantastic. You didn't ask me about insulin compliance. That is one of
Okay.
the key point in here. You should also ask like how long you've been diabetic and how frequent you are checking your blood glucose level, and what about your diet plan, like in a day, whole diet history you should ask. As I said, like why patient is having like uncontrolled blood sugar, you need to find out the reason, okay? So basically, patient missed insulin and she's also like not checking blood sugar frequently, and she's also having eating disorder issues, and that is basically underlying reason for decay. Okay,
Okay,
so
understood.
you missed that point. So be careful, like when you are asking history, whenever any patient coming with that diabetic ketoacidosis or like hypoglycemia, like you need to find out the reason for that. Okay. So
Okay,
let's
madam.
discuss
I
that.
thought that it was the first time for her.
Yeah, that's why you have to ask like how long you are
Ah,
having diabetes.
okay, okay.
Okay. So 18 years old female has been admitted to the hospital in the ED for diabetic ketoacidosis. Now she is ready to be discharged and she has been diagnosed with diabetes. So task is relevant history, explain the condition to the patient and management. So your first question, when were you diagnosed with diabetes and what medication you are taking at home? Okay. And is your blood sugar under control? What was the at home? What was the last reading of your blood sugar? Are you following up with your GP? So basically that diabetes diagnosed 2 years ago, she's taking insulin and she missed some doses, not regular with insulin. Okay. And she's not checking her blood sugar regularly as well. You should ask about, do you skip your meal or are you taking insulin with your meal? Have you ever been admitted to the hospital with complication of diabetes? And when was the last time you visited your GP? So she visited her GP 2 years back after I've been diagnosed with diabetes. Um, and she's not following up with her GPs. Could you please tell me about your dietary habit or daily diet plan? So she eats 2 to 3 times a day, large amount of food, and you should ask about like any eating disorder problem. She does feel guilty after having large meal and she induces vomiting. Okay, and she's also uses laxative like 3 times per week as well. She thought she's very fat and she like doesn't want to look at mirror because of her like body images. Her period is irregular. You should ask about details. Period history, sexual history as well. She's 18 years. Psychosocial history, very important. General health question, SADMA. Then past medical history, past mental history, family history is also important. Then physical examination, like at this moment BMI, then general appearance, vital sign, latest blood sugar level, cardiovascular, respiratory, abdomen examination. Then investigation, what you can do, like patient is ready to discharge, so you can order some blood investigation and GP can follow up. And please check either ECG already done or not to check any arrhythmia, ABC, UEC, thyroid function, liver function. Then HbA1c is very important. That will tell you last 3 months blood, how was the blood sugar, was it under control or not. Vitamin D important for this girl. And also like any hormone test, especially if she's complaining about irregular period. Okay. Then the management. So usually like hospital admission criteria for bulimia nervosa, or it has to be a hemodynamically unstable patient. At this moment, you don't need to think about that one because patient was already admitted, patient was treated for decay, now she's ready for discharge, but just for your learning purpose, okay? So pulse rate, if it is less than 50, postural drop, temperature, any changes in the ECG, any electrolyte disturbance, or any suicidal tendency, like eating disorder with suicidal tendency, severe depression. So those are the criteria for hospital admission, okay? And and underlying diabetes, because she skipped the insulin, she might develop ketoacidosis as well, okay? So those are the reason for hospital admission. So you need to explain, like at this stage you are suffering from two conditions. One is diabetes, another is eating disorder. Most probably you have bulimia nervosa. Have you heard about it? It is very common condition in your age group. A person with this disorder eats large amount of food in a short amount of time, and basically they lose control and can't stop eating. And after that, they feel guilty and they induce vomiting to compensate. And unfortunately, it's a very risky situation for you as you are not taking your meal and insulin regularly. Okay. And you had a complication of diabetes, we call it diabetic ketoacidosis. And that's why you admitted to the emergency. Because when you induce vomiting, you lose water along with salt as well from your body, and it is dangerous because it can damage your kidney. That can cause water and mineral imbalance in your body, and in the long run it affects your heart, lungs, eyes and nerves as well. Okay. So eating disorder can affect your health as well. That can cause dental problem. And what I notice your main concern is body weight. Let me assure you that you can achieve ideal body weight without having to induce vomiting or using laxative. So what I'm going to do, I will involve multidisciplinary team approach. So I'll refer you to the dietitian. They will give you a proper diet plan, okay? I'll also refer you to the endocrinologist to adjust your insulin dose, and psychologist for cognitive behavioral therapy. If you give me consent, I will arrange a family meeting because family support will be essential, okay? And I'll write a letter to your GP and he will follow you up regularly to prevent any future complication. Okay. There is also support group like eating disorder support group in Australia. If you want, I can give you reading materials for that. Okay. So that's the case for diabetic ketoacidosis counseling and eating disorder.
Okay,
So
thank you
that's
very
all
much,
for
ma'am.
today. Was that?
Thank you very much, ma'am.
No worries. That's all for today. Do you have any question like the cases I have discussed today? Any question regarding cases or about random role play session?
One small question regarding that fracture thing. Since it's a minimal trauma fracture, are we going to start her on something like bisphosphonates as well?
No, you don't need to because you need to find out the causes of that pathological fracture.
Okay.
Okay.
Hello, ma'am.
Hello.
Ma'am, I have a question about the last case. Type 1 diabetes is can be like at any age, or it can be like in teenage, or can start just after birth. How
So,
we can say that's just, yeah, like
so
this one is with the eating disorder. How can we say that it's because of this eating disorder? Because nothing is given in the history like that in the question. So please
So
mention,
you are not
explain
sure,
that.
you are not
Yeah.
sure it's the type 1 diabetes or type 2 diabetes because type 1 diabetes usually like that happen in that adolescence age group or like kids. Type 1 diabetes is common and like it's an autoimmune condition. But type 2 diabetes also can happen at this age group. So without like getting any further information, don't say that it's a type 1 or type 2 diabetes. If that's already mentioned in the stem or your patient told you like doctor I'm type 1 diabetes, so that's fine. um, the problem in here, I'm not sure like why you are worried about type 1 or type 2. But in here, the underlying cause why patient like coming with diabetic ketoacidosis, you need to find out the reason. The reason in here, she missed her insulin. Her meal plan is not healthy. And when you dig more and you found out that patient also having underlying eating disorder. So you have to address both two issues. Okay? You got my
Okay, ma'am.
answer?
Yeah, ma'am. No, I'm just asking. Like in the question, can you please move back the slides and to go on the question? Yeah. So here, nothing like nothing mentioned about eating disorder kind of thing. Just as a case of diabetic ketoacidosis. Yeah.
Yes, so that's
Yes.
your job. That's
Yeah.
candidate job to find out the reason for diabetic ketoacidosis. Why patient presented with diabetic ketoacidosis? What was the reason? And
Yeah.
when you
That.
ask relevant history, you notice patient having underlying eating disorder. And your second task was explain the condition to the patient. That means explain the condition. As I said, like there are two things going on. The condition I already put it in my slide. That counseling. Have you noticed you are suffering from two conditions? You have to explain that two things. And the management, how you are going to manage that two conditions simultaneously.
Okay. Okay. Now got that. Got that. Thank you. Thank you.
Okay, no worries.
Thank you.
Yes, definitely, Dr. RM is very tricky case. So don't think like always you will get everything in the stem. So there, your job is to find out the reason behind it. Okay.
Yes, Dr. Got that. Thank you.
Any question?
Okay,
Yes.
the one question is that are we supposed to explain about the what is the diabetic ketoacidosis or just
Yes, so you can ask your patient like how much do you know about your condition? You want me to explain, and then you can explain in a like non-medical term, like not using medical jargon.
okay? Thank you.
So this session will be available on the website. Yes, Dr. Arshan will upload it in the on that website, okay? But that will not be the live on Facebook. So that's all for today. Let's finish our today's session. If you do have any question, feel free to ask in the group or just reach out Dr. Arshan. I will try to answer all of your question, okay? And today is just a trial session. Just give you an idea like how we do our classes. And as I told you earlier, like we divided our course in theory session and that role play session. So theory session or theory class, subject-wise, cluster-wise class, Dr. Arshan will take, and me and other clinical teacher will take that random role play session. Basically, the case that are coming last couple of months, we are discussing those cases, okay? It's just a sample cases that are coming in your exam. If you don't have any questions, so we'll finish now. Good night, everyone.